is a remote village nestled in the mountainous district of Sheikh in Somaliland, northwest Somalia. Here there are hardly any public services, such as safe drinking water or sanitation.
waxaan haysan badamay aan ka soo qaaday marka hadii aan haysan lahaa tahay waxa xisran lahaa mala waxa dad barigaas ay yeeli lahayd halka geyn lahayd saamay noqoteen
In Kulule IDP camp in Basaso, Puntland in northeast Somalia, these rubbish dumps are the playground for the children living in the camp and host communities. Here children scavenge and play, even as new garbage is brought in from the camp. The waste is riddled with bacteria and disease. Diet and disease are intimately related. A sick child is likely to have reduced appetite, higher caloric requirements, and difficulty absorbing nutrients. And a poorly nourished child is more susceptible to disease. While malnutrition can result either from poor dietary intake or disease, it is often a combination of the two. UNICEF, with support from UKaid from the Department of International Development, has launched a new approach. With local partner Somali Relief Society, SORSO, UNICEF has launched a series of campaigns to address malnutrition through hygiene and sanitation education. Muhammad Ali is a village elder and a volunteer hygiene promoter in Basaso. He walks house to house with posters illustrating hygiene do's and don'ts. For pastoralist families, movement from one place to another in search of new pasture means families are often far from health facilities. Even though mobile clinics have been introduced to reach children in the remotest areas, these distances are often the difference between life and death. Today, the Somali Red Crescent team is going to Dallo village, 51 kilometers from Berbera town in Somaliland. Children excitedly await the arrival of the Red Crescent mobile team after their own long journey to get to the clinic. This is the third visit of Safia Abdullahi to the mobile clinic. When she first arrived, both of her children were suffering from malnutrition.
The case was very bad and very malnutrition because they are nomadic and they didn't get enough nutrition and enough milk. The first time I give him vitamin A, I give him amoxicillin syrup, I give him the Beleminate. I tell the mother to give her 4.5 pieces each day, not share with the patient, and to give him 4 times to give only water, only clean water, to make high sanitation and hygiene of the home.
The screening results for Safia's children show progress. However, they are still receiving special treatment with ready-to-use therapeutic food, formulated to treat severe and acute malnutrition. Malnourished children suffering from medical complications are referred to the nearest hospital with a stabilization center. There, children receive inpatient care and are treated and monitored around the clock. 4 months pregnant Amina Mohammed walked for days to bring her 2 sick children to Berbera Hospital. Admitted with severe malnutrition, they are also suffering from measles and diarrhea. At a community meeting hall in Bokala Bush IDP camp west of Basaso town, laminated health posters cover the walls. UNICEF's Somali partner leads a discussion on best practices. And what about those just coming into this world? What challenges face mothers and their newborns? These mothers are attending an infant and young child feeding support group. Here they learn about the many benefits of exclusive breastfeeding and appropriate young child feeding.
muddo badan baan waxaan qabanaynaa awareness muddo badan dadka markii wax lagu celcelishay qayb baa wax qaadata qayb waa diidaan maalin walba waan noo diidin waxaan sameynaa weekly meeting baa waxaan la yeelanaa hooyooyinka kadib awareness baan u sameynaa waxaan u sameynay group ka wacyigeliya oo supporting group ah baan campus ka sameynay waxay sameeyaan dadka guryahooda ugu tagaan way nagu soo yeeraan waxbay
Abdi Hakim visits Somali families in the IDP camps whose children have been treated for severe malnutrition. He makes these regular checks to ensure the children don't relapse.
marka hadda cunugan xaaladiisa caafimadeed aad bay u fiican tahay nafaqa darro kama muuqata waayo ummadkiisu wuu furan yahay jirkiisana waa caadi macnaheedu wuu san yahay wax dibacsanaan laha barar ma jiro.
Hawa Mohammed's children are out of the danger zone, and she regularly attends sessions of the infant and young child feeding support group. Thanks to the support of UKaid, UNICEF plans to expand this fresh approach, integrating activities of nutrition, safe drinking water, hygiene and sanitation. A holistic approach towards a healthy future for Somali children.